So what do local health providers think of some of the provisions in the health insurance reform plan? Fox 11's Becky DeVries has multiple views.
Those who manage local healthcare providers say the president's goal of improving the healthcare system is noble and one that needs attention.
All the bills that address increasing access are important.
Heidi Selberg represents St. Mary's and St. Vincent hospitals and is also on Democratic Congressman Steve Kagan's Healthcare Advisory Committee. She and others have questions about the plan.
There are some proposals that talk about reimbursing hospitals at Medicare rates. And across the country, there are huge discrepancies in how Medicare pays hospitals and healthcare providers.
I have always believed that the government should be the official regulating the industry and not participating in the industry.
Jeff Mason is president of the board of Aurora Baycare Medical Center as well as CEO of Baycare Clinic. He says a number of things in the healthcare bill need work. One question that has come up at listening sessions in Northeast Wisconsin and at President Obama's town hall meeting, what will the new plan do to the number of doctors in the country?
I think that's a valid concern. I think that many of the uninsured, they do get care today because they'll go into an emergency room. And so there are physicians, there are staffing, and in an emergency or urgent situation, they do get cared for today. So I don't think that problem will be quite as expansive as some people might.
Already there are shortages of primary care physicians. We know that. And that certainly could increase that concern. This is not just an issue regarding health care reform. It's an issue regardless.
While the health care reform proposal continues to change, so does the discussion surrounding it. Becky DeVries, Fox 11 News.
Now, during his town hall meeting today, the president talked about reimbursing doctors providing preventative care and creating incentives for people who are willing to be primary care physicians. We haven't seen health care listening sessions in Northeast Wisconsin this week. However, a number were held last week. Representative Steve Kagan has one scheduled for the end of the month in Marinette.